I'm Dr. Durgaprasad, Professor HOD, Department of Cardiac Surgery, Vaidehi Hospital. Supraventricular tachycardia is where the ventricular rate is more than 150, 160. Any heart diseases, patients can have this. Coronary artery disease, patients can have supraventricular tachycardia. And thyrotoxicosis, where the thyroid levels are very high and patient can have a very high rate. And there are so many obesity patients, then some conduction abnormalities. All these patients have supraventricular tachycardia. This can be prevented. Initially, when you see a patient with supraventricular tachycardia, there is something called a Valsava manoeuvre or something. You try to blow your nose and mouth, close your mouth and blow your nose so that it will stop. Or a lot of people give curetted massage, or even a plain cold water on the major arteries like in the neck or axilla can reduce the temperature, and the rate also can come down because the baroreceptors are all there. And still not this one, then you have to be admitted in the hospital. He has to be on beta blockers, or even what do you call as, you have to sedate the patient, or on sedation or on complete paralyzing. You can give a zinc shock. What we give, we give somewhere around, we start with 160 joules of zinc shock to revert the supraventricular tachycardia into a normal sinus rhythm. Otherwise, there is also something as radiofrequency ablation, alcohol ablation. They just ablate that conduction pathway so that the pathway becomes normal. So many things can be done through intervention. Best is to prevent it, and through medications like beta blockers or calcium channel blockers. Still patient is recurrently getting it and not able to control, then we can opt for a surgical options like radiofrequency ablation, and this is all done through angiography, through a femerlatric puncture. You can just inject alcohol into that area. They'll map that area where the conductions are done, and then they'll do it.